Assalamualaikum. My name is Sayeda Afzal and my roll number is BP1650226. Today the topic of my presentation is the combination of two drugs, which is ethambutol and isoniazid. Basically, this combination of drug is used to treat the patient suffering from tuberculosis. Now the introduction. The key to treating active tuberculosis disease is multiple drug therapy for sufficient time to kill the organisms, as well as to prevent the development of the resistant strains of the Mycobacterium tuberculosis. Patients with active TB diseases likely harbor organisms with random mutations that confer drug resistance to a given drug. If a single drug is given, it would reduce the number of drug susceptible organisms, but leave the drug resistant organisms to replicate. By using multiple drug therapy, the likelihood of encountering organisms with mutations to multiple drugs is actually reduced. Now the indication. Ethambutol is a bacteriostatic at low doses and bactericidal at high doses. It is moderately effective against the fast-growing bacilli. It has a little sterilizing activity and is primarily used to prevent the emergence of drug-resistant organisms, whereas the isoniazid has the most cidal activity versus rapidly multiplying Mycobacterium tuberculosis during the initial phase of the therapy, which is followed by the ethambutol, rifampin, as well as streptomycin. These drugs is rapidly absorbed and diffuses readily into all fluids and tissues, and is largely excreted in the urine within the 24 hours, mostly as inactive metabolites. Drugs that have potent early bactericidal activity more rapidly decreases the infectiousness of the patient and reduce the likelihood of developing resistance within the bacillary population. Now the rational use. Ethambutol is used for the treatment of the pulmonary tuberculosis. It should not be used alone, but rather in combination with at least one other anti-tuberculosis drug such as isoniazid. This combination shows effectiveness against the strains of the Mycobacterium tuberculosis, but not so much against viruses, fungi, or other bacteria. Now the irrational use. Stopping the medication too early or skipping doses may allow the bacteria to continue to grow, which may result in the return of the infection and cause the infection to be more difficult to treat as it develops the resistance against the specific drug. Isoniazid may interact with food containing tyramine or histamine, such as cheese, red wine, certain types of fishes. This interaction may cause increased blood pressure, flushing of the skin, headache, dizziness, or fast heartbeat. Alternative choices. There are some alternative choices which can be given instead of this combination, like isoniazid plus rifampin, isoniazid plus rifampin plus ethambutol plus pyrazinamide, isoniazid and rifampin plus streptomycin and pyrazinamide. Isoniazid and thioacetazone can also be given as an alternative choice. Now the alternative brands. Butyrex plus INH, Liscobutol plus INH, and Myambutol plus INH. The prices are listed from low to high prices. Drug-drug interaction. Isoniazid inhibit the metabolism of the bound drugs, which may increase their plasma concentration to the purpose of the toxicity. This combination could move with the subsequent medicines and products like aluminum hydroxide, bromazepam oxide. Hypersensitivity to bactericide and ethambutol may be a reason. Additionally, this mixture should not be used if you have got the subsequent condition, like if the children is aged below 3 years, or you are suffering from hypersensitivity, lactation, optic inflammation. Now the case study related to the tuberculosis, in which we give the combination of the drug to treat the patient. James is a 30-year-old male who was admitted to the hospital from home after 2 to 3 weeks of cough, nocturnal sweating, loss of appetite, and the patient co-jointly complains of the subjective fevers, chill, dyspnea, pain, fatigue, and unintentional 10 pounds weight loss over the past many weeks. Now the subject, the age of our patient is 30 years old, the gender of our patient is male. The problem which our patient is facing is coughing for the past 2 to 3 weeks, nocturnal sweating, loss of appetite, as well as fevers, chills, dyspnea, fatigue, pain, or weight loss. family history. The mother of our patient is suffering from hypertension and father is suffering from the diabetes. The personal history of the patient is that the patient has a 10-pack-year history of smoking, but quit several weeks ago when the current illness started. The patient denies illicit drug use but does report drinking alcohol on weekends. Patient is a laborer and is currently working for cash on a new home construction project in close contact with the other workers. Now the object, these are some lab reports which shows the blood pressure, temperature, heart rate, respiratory rate, sodium, potassium, calcium, chlorine, platelets, creatinine, WBCs, hemoglobin, HIV test, as well as X-ray, chest X-ray, sputum culture, and MGIT of the patient. Assessment. Based on subjective and objective, the patient having family history of diabetes and hypertension is diagnosed with the tuberculosis. Now the plan. Patient was originally administered isoniazid, rifampin, pyrazinamide, and ethambutol combination for 7 days per week for 8 weeks, followed by isoniazid and rifampin 7 days per week for 24 weeks. The thing that is important in this case is that the most of the anti-tuberculosis drug in first lines are hepatotoxic. So patient must need liver function monitoring from time to time during this treatment period, and in severe liver damage, only one drug is used, not the combination of the drug is used. These are some references from which the topic is taken. Thank you so much. Allah Hafiz.